A cruise ship anchored off Tenerife. 3 passengers dead. A virus that kills 1 in 2. The MV Hondius is now the center of an international hunt for the source of a Hantavirus outbreak tearing through its decks. Fingers point to the southern tip of Argentina. Argentina says, "Not us." And somewhere between denial and discovery, the trail keeps growing colder. Authorities in Argentina's southernmost province are pushing back against speculation that the tourist city of Ushuaia triggered the deadly Hantavirus outbreak aboard the cruise ship MV Hondius. The vessel, now anchored near Tenerife, has become the center of an international health investigation after multiple passengers fell ill with the Andes strain of Hantavirus, which can be fatal in up to 50% of severe cases, according to the World Health Organization. A Dutch couple and a German national have already died, while several countries, including France, Spain, Australia, Canada, the UK, and the United States, are evacuating citizens from the ship. The outbreak began attracting global attention after media reports suggested a passenger may have contracted the virus near a landfill site outside Ushuaia, where rodents are known to gather. But Tierra del Fuego health officials strongly rejected that theory. Director General of Epidemiology and Environmental Health for the Argentine province of Tierra del Fuego said,
"We are reaffirming the current status of hantavirus in our province. I'm going to be a bit graphic, I don't mean to be disrespectful, but these are the hantavirus cases we've had in our province. I've included data starting in 2000, but I can go back as far as you like. The graph isn't bad. Ushuaia, Rio Grande, Tolhuin, we had 0 cases of hantavirus through April 1st, which was when the ship departed, and since then, up to the current epidemiological week, there continues to be 0 cases of hantavirus in our province."
The province's Director General of Epidemiology and Environmental Health said the region has not recorded a single hantavirus case since Argentina added the disease to its mandatory national surveillance system in 1996.
Basically, we found out about the hantavirus news through the news, through social media. Regarding the impact on tourist movement at the company, it has mostly been inquiries. They have asked how the situation is, whether we have seen anything strange. Honestly, from our side, no. In fact, I understand that not even the first case has been confirmed in Ushuaia, so it would be strange to think it came specifically from Ushuaia. Perhaps I would broaden it to the area of Argentina or Chile, which I understand is the strain that was passed on, and beyond inquiries, it has not altered any reservation, has not altered any movement, and everything is going well as we expected in the low season.
Still, Argentina's national government has dispatched expert teams to investigate whether infected rodents may have reached the region as ecosystems shift. Epidemiologist Eduardo Lopez warned that changing environmental conditions mean authorities cannot fully rule out new transmission zones. Officials are now trying to reconstruct the movements of a Dutch couple believed to be patient 0 before they boarded the ship in Ushuaia on April 1st. Authorities in Chile and Uruguay have said the couple likely did not contract the virus there, based on the World Health Organization's estimated incubation period of 1 to 8 weeks. Meanwhile, the outbreak is expanding internationally. French Health Minister Stephanie Rist confirmed on Monday that a French passenger from the ship tested positive and that her condition is deteriorating.
We are taking very strict measures with the Prime Minister, Sébastien Lecornu, the strictest in the European Union, to protect the French people. Because the very beginning of the epidemic is crucial, we must break the chains of transmission of the virus. This isolation will take place in the hospital during the first few days to undergo the necessary battery of tests, genetic testing, and PCR tests to obtain the results. We will see the details of the 42-day isolation period in the coming days.
When asked about the status of 8 French citizens who had been in contact with one of the cruise ship passengers while on a plane with them, Rist said,
"These individuals have been identified and tested. They have tested negative and are currently in isolation."
The U.S. Department of Health and Human Services also confirmed that one American passenger being evacuated from the ship tested mildly positive for the Andes strain, while another passenger showed mild symptoms. For Ushuaia, known globally as the end of the world and a gateway to Antarctica tourism, the outbreak has also become an economic concern, with officials worried the crisis could damage the region's vital cruise industry. A deadly outbreak at sea, a rare virus on board, and passengers trapped far from shore. What began as a luxury voyage across the Atlantic has turned into a floating health emergency, raising urgent questions about containment, survival, and how far this silent threat has already spread. 3 people have died following a suspected hantavirus outbreak aboard a cruise ship sailing in the Atlantic Ocean, according to the World Health Organization. At least 1 case has been confirmed, while 5 more remain under investigation as health authorities race to understand the scale of the incident.
Who is aware of and supporting a public health event involving a cruise vessel sailing in the Atlantic Ocean? To date, 1 case of hantavirus infection has been laboratory confirmed, and there are 5 additional suspected cases. Of the 6 affected individuals, 3 have died and 1 is currently in intensive care in South Africa. Detailed investigations are ongoing, including further laboratory testing and epidemiological investigations. Medical care and support are being provided to passengers and crew. Sequencing of the virus is also ongoing.
The outbreak occurred on the MV Hondius, a Dutch-operated cruise vessel travelling from Argentina to Cape Verde. The ship had been on a weeks-long journey that included stops in Antarctica, the Falkland Islands, and other remote locations before the health emergency unfolded. The first reported victim was a 70-year-old man who died on the ship. His body was later removed at St. Helena, a remote British territory in the South Atlantic. His wife subsequently collapsed at an airport in South Africa while attempting to return home and later died in hospital. A third fatality has also been reported, with the body still on board the vessel as it remains off the coast of Cape Verde. 2 additional individuals, believed to be crew members, are reportedly in need of urgent medical care, though local authorities have not yet approved their transfer ashore.
Yeah, unfortunately, there are no specific vaccines for hantaviral diseases. There are no specific antivirals to treat the disease in humans with. Treatment primarily is supportive care, so early identification of cases, seeking medical attention, and getting into facilities that are capable of assisting, for example, in this case, with the respiratory distress portion of the disease. That's really critical, but specific medical interventions, just nothing exists at this time.
Around 150 tourists and approximately 70 crew members were believed to be on board at the time of the outbreak. Health officials in South Africa have begun contact tracing efforts, particularly in Johannesburg, where 1 infected passenger is currently receiving intensive care treatment. Hantavirus is a group of viruses primarily spread through contact with infected rodents, particularly through inhalation of airborne particles from urine, droppings, or saliva. While rare, the infection can be severe and potentially fatal. The virus is known to cause 2 major illnesses. Hantavirus pulmonary syndrome affects the lungs and carries a mortality rate of around 38%. It typically begins with flu-like symptoms such as fatigue, fever, and muscle aches, before progressing to respiratory distress. The second condition, hemorrhagic fever with renal syndrome, affects the kidneys and can lead to internal bleeding, low blood pressure, and acute kidney failure in severe cases. There is currently no specific cure or targeted treatment for hantavirus infections. Medical care focuses on managing symptoms, including oxygen therapy, ventilatory support, and, in critical cases, dialysis. Global data suggests that approximately 150,000 cases of hantavirus-related illness occur each year, primarily in Europe and Asia. However, outbreaks on cruise ships remain extremely rare, adding to the concerns surrounding this incident. Health authorities emphasize that early detection and supportive care significantly improve survival chances. Preventative measures focus on reducing exposure to rodents and avoiding contact with contaminated environments.